Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice, Private Physicians Medical Associates, PPMA, with your host, registered dietitian and nutritionist, Meg Tancredi.
Hello, everyone, and welcome to Nourish MD podcast. I am your host, registered dietitian Meg Tancredi, and today we have a fabulous human being on the show today. We have Dr. Elizabeth Kraft. I am so excited to have her here. We had a fantastic conversation earlier where I got to meet her, and we have some good questions lined up today about a really important topic, breast health. So before we dive into that topic, I'm going to go ahead and read her background. Dr. Elizabeth Kraft is a board-certified general surgeon and fellowship-trained breast surgical oncologist and oncoplastic surgeon. She completed her residency at New York Presbyterian, Weill Cornell's general surgery program, and her fellowship at University of Southern California, go Trojans, and Hoag Hospital in the nation's only oncoplastic fellowship under the mentorship of Dr. Melvin Silberstein, who she has since taken over his practice in his retirement. She currently practices at Hoag Hospital's Breast Center in Newport Beach and Irvine and specializes in not only removing cancers from the breast, but also in the reconstruction so that the cancer is taken out safely first and foremost, but the breast cosmetics are also preserved in each operation. So Dr. Kraft, thank you so much for being here. Welcome to the show.
Yeah, thank you, Meg. I'm so happy to be here. Thank you for having me.
So now I'm going to ask you just more basic question, but just kind of what drew you into becoming a breast surgeon, specifically breast cancer? You know, what led you there?
Yeah, so kind of two things. First and foremost, I really realized throughout my training, I didn't know this going in. You know, it's something that you kind of discover along the way. We get to try a lot of different things. And luckily in med school, there's a lot of good advice about really like following where you feel calm, where you lose track of time, where you just feel like you could be there forever, because a lot of time you are going to be there forever, you know, because it's brutal hours, like being real, you know, it's a lot of training and I don't think any of it is extra. I needed every second of that training to practice medicine at the level that I do. It's just so much information. Wow. And that's kind of the difference that you see between like levels of, levels of not achievement, but like designation in medicine, you know, like a doctor versus a PA versus a nurse. It's all about hours. So the doctor has done 10,000 hours. The PA has done maybe 2,000 and the nurse might have done 500, you know, and it's like the 10,000 hour expert thing. So it's just a matter of exposure and the knowledge. So it's just a lot of information and you have to get through it. But okay, I'm going back to why I chose surgery. So yeah, the first thing was I realized that I really loved what would happen when I would see a female patient. So I'd see a woman patient and she would look back and see someone that looked like her as her doctor. And that was so special. I noticed that was different than maybe when I probably take for granted what the men were experiencing, but maybe the men feel that way too. Like when, you know, they see a doctor that looks like them, but I noticed just kind of the women relax a little bit when they saw me in the room and saw that I was going to be part of their care team and could connect with them on a level. And then the cancer patients, you know, I went through one of my early interactions where there was a male breast cancer surgeon and he was telling a woman that she needed a mastectomy, which means the breast is removed. And I could just see her shatter. You know, when she heard that she was going to lose such an integral part of her body, you could just see her kind of collapsing. And of course, he couldn't understand, you know, it's different. I could never understand what it would mean to lose a testicle, right? For testicular cancer. I just can't. I haven't had that experience. And I noticed that interaction. I noticed how the disconnect, or I saw the disconnect between the surgeon and the patient. And I thought, hey, there's somewhere where I can help and I can, come from a place of understanding of what it would mean. And that doesn't mean that, all the men pathologies need to be treated by men and all the women pathologies need to be treated by women. But I just saw a place that I could help. And so that was the one part about the breast cancer patients. And I saw also that this guy saw these patients for years and years, and he had a relationship with these patients. He didn't see them once and never see them again, which is what happens a lot of time in general surgery. Like if you need your appendix out or your gallbladder, you see them once and you're done. It's not a long relationship. And I just realized I'm a kind of person who likes to get to know my patients. I want to know how they're doing. I know that comes with a cost because I also care when something bad happens to them.
Yeah.
So it is a challenging field because it's not all rainbows and butterflies. People don't make it all the time. Luckily, though, in breast cancer, most of the time it's a good outcome. And I knew that I could live with that.
Okay.
I knew that I could kind of handle a specialty where most of the time we were giving good news. Mm-hmm. And there weren't a lot of days where I had to tell somebody that, their family member wasn't going to make it. I also really didn't like the surgeries where there was a possibility the patient wouldn't make it because it's just, I'm too much of an empath and it's too hard on me. Mm-hmm. And I knew that I would burn out really quickly if that was part of my job. And so I really didn't like trauma because of that, because a lot of times in trauma, you're having to have these horrible conversations. And sometimes in young patients, and it just figured out that wasn't for me. And then as far as like the plastic surgery aspect goes, I've always been an artist. So like out of the womb, I have been drawing, coloring, painting, clay, like anything that I could do art with, I've done it. But like any, practical child, I was like, oh, well, I can't have a living out of that. No way. I wasn't really exposed to any artists. I grew up in the Midwest where there weren't a lot of artists. Most people had very practical day jobs, and I didn't see musicians, actors, artists, anything like that growing up. So I didn't really think that was possible as a job. But then again, when I went into medicine and started rotating through things, I saw what artists the plastic surgeons were. And I was like, oh my gosh, that's what I love to do. I love to create. I love to put things back together. I love to kind of like the spatial awareness. And I'm, for some reason, like a geometry whiz. I never, I had a great high school teacher growing up who she was amazing and just made it seem like really easy, and geometry just clicked for me. And a lot of plastic surgery is geometry. So that it all just kind of came together. And when I heard that there was a specialty where you put together breast cancer and plastic surgery, which is what Oncoplastics is, I was like, oh my God, I have to go to this fellowship. I have to be there. I have to train with this guy, Mel Silverstein. And I have to learn to do what he does because that's my dream job. And so that's what I did. I put all of my focus in residency to getting into that fellowship. And there were only 3 spots. And so, out of the whole nations of applicants. And so, it was amazing how things aligned when I clicked in to what was meant for me.
Transform your health with PPMA's personalized support from our expert registered dietitian. Get the clarity, confidence, and tools you need to feel your best. Visit privatemds.com to get started today.
I want to ask you, one thing that I had written down was that there's that statistic, 1 in 8 women will develop breast cancer during their lifetime. Is that an accurate statement?
Yeah, that's the right number as of now. Some studies have said like 1 in 7 even, which is really depressing. Yeah. But yeah, no, that's the real number. And it's like a 10% risk over our lifetime as women. And men have kind of a same risk for prostate cancer. Oh, so it's
Right.
Yeah, we're not alone. The men have the prostate to worry about, but they're both definitely the most common cancers in men and women.
Why is that happening with women? Like with that statistic being 1 in 7 or 8. I mean, even if it was 1 in 10, still no, thank you. And it's like primarily like the younger women now, or what are the
Yeah. So we're seeing this in a couple different cancers too, which is just, again, this is kind of the bummer part of the podcast, but we're seeing it in colon cancer. We're seeing it in breast cancer. And the colon cancer, they're able to make a little bit more correlates to like our processed food intake,
right?
Just smoked meats, processed meats, stuff like that. They can really kind of draw that correlation and causation in colon cancer, from my understanding. Again, not a colon cancer surgeon, but from what I've read, colon cancer, they can kind of attribute it to diet.
Yeah.
But we are in younger and younger women, we're seeing these spontaneous breast cancers. So it's not a gene that we know about at this point. But my guess and what kind of the surgical societies and cancer societies are proposing is it's probably some environmental thing, and it's not like any of us live in a vacuum with just microplastic exposure or just processed food exposure or just pesticides, and we live and it's happening all over the world. So it's not just the United States.
Okay.
It's everywhere. So that tells us maybe it's our water, maybe it's our plastics, maybe it's any of that stuff. So it's really overwhelming when you start thinking about everything. But I always try to practice what I preach to my patients. So like personally, I try to avoid as much plastic as I can. I do think that microplastics probably have a good deal to do with like endocrine disruption and we're seeing like even young girls get their periods earlier and earlier, even when they're not obese. And like the obesity can be a part of it, but also, the endocrine disruptors are a thing. And
absolutely.
I try to do everything in my environment to keep those as low as possible. So I have like glass containers that I put my food in. That's been a big change because I used to always take like the to-go containers from restaurants and then like heat them up in the microwave, which apparently is the worst thing ever. So
one step at a time.
I know. So I have like glass containers. I drink out of a non-plastic water bottle all day, every day. Cause water, and I drink out of filtered water, but then again, my water filter is plastic. So it's like, oh my God, I need to change my water filter. It's kind of never ending, but I also really, really, really focus on my diet. And I eat kind of an anti-cancer diet anyways, but I try to keep inflammation as low as possible. So I really try to limit my gluten and dairy. I also eat a lot of fruits and veggies. I go to the farmer's market every weekend. I don't miss it because I want those fruits and veggies. And once you taste those, like it is not, I can't ever eat. I mean, I will obviously if I don't have available, but like an apple from those places versus like an apple from, a regular store, it's totally different. And the vegetables, I don't know, it just like activates something in my core. I feel like this primitive instinct of like, oh my gosh, this food is real. It's fresh. Like I want more and more of it. So those are the things that I do in my environment to keep myself, as low risk as possible. And I tell the same thing to my patients, and I also like, it's so important to control our stress, to try and have a mindfulness practice, to meditate. I have to do all that stuff because my job can get real depressing if I don't like kind of keep myself in check, especially when I lose a young patient or something. Like that's really sad and really hard. And I have to do things to kind of keep going, essentially, and kind of make sure that I'm as healthy and I can give my patients my best at all times. But like sleep is so important. Oh my gosh, sleep, alcohol reduction. Like I personally, again, everyone's journey is different, but after I read like the 20th study that was like alcohol increases your cancer risk, I was like, okay, I guess I'm not drinking anymore. Cool. But
yeah, when you start reading, I mean, I'm loving you were speaking my language, so you it's great. I mean, like the anti-inflammatory diet, anti-cancer, I mean, is extremely important. And so, I always want to add in, if anyone's listening and they're like, okay, well, I don't follow that diet, or, oh God, my sleep isn't, on point. I'm not getting the 9 hours I need, that sort of thing.
Yeah.
I'm going to remind them it's okay. This is why we do one thing at a time. Right. So if
exactly
the first step is like, maybe I want to just start going to bed 15 minutes earlier. Great. Perfect. Start tonight,
Yes.
And little by little, you just change it. But I am going to support you fully in like the fact that you go to the farmer's market and get your fresh produce, because the taste is everything.
Yeah.
I mean, you can eat, I grow my own tomatoes at home, and they're just,
yes, tomatoes.
I go by my grocery store and I'm like, where's the flavor? Like, what's happening here? You want that stuff to taste good because
totally
nourishing. It's good for you. Like, let's do that. And the part on the alcohol, I think first and foremost, alcohol has no health benefit. I have said this out loud, and I don't follow zero alcohol, in my own personal life, to be transparent. However, it is important to be mindful. It is important to pay attention. For example, if someone consumes 3 glasses of wine in the evening, my question is, can you go down to 2? Can you slow that down? Are you paying attention? Right. And then that's where the mindfulness comes in, right? Like
totally. Well, and I love my Aura ring too, because like, and whatever, we're not sponsored by Aura, by the way, but it shows you your sleep. And that was another, and again, I echo what you say, like, this is totally a personal decision, everything in moderation. But when I learned about alcohol and sleep, and then I saw what was happening to my sleep, and I was like, are you kidding? I had like a sip of wine. Like, why is that affecting my sleep? But it was, and that I just didn't know that, right? Like, I had no idea about that information. So it's such, this is like a double-edged sword, the time we're in, because we have access to so much information, but then it also gets really overwhelming. And it's like, okay, well, I just have to stop doing everything that I love in my life and just be super boring and grow all my own food, never eat out and never drink or do anything.
Yes, I know. And you're totally right. I mean, and so it doesn't have to be so black or white, right? But it's like, like what are the simplest things that we can do? Like, and it's okay. You don't have to turn everything around in one day. It's like, let's just pick one thing and go.
No. Well, and honestly, it's taken me probably since COVID, when I actually paused for the first time ever and like saw what I was doing to my fitness and sleep and actually took a break. It's taken 6 years, like, to get, and I have not arrived. Like, I'm still learning stuff every day. So, you, just like you said, you do one thing at a time. And the pitfall of myself has been like, I'm doing everything at once. I am changing my whole life at once. I, got on Claude the other day and told Claude to meal prep for myself. I gave my husband a 70 list item of groceries from the store. And he was like, what are you doing?
Oh, wow.
So anyways, chill, take it one step at a time. It didn't work. And I didn't do any of those things. So like, it's just a good lesson. Like, do one thing at a time. Nobody's perfect. Like, make a dent in one small aspect of your life each time, and it takes months to to make a change. It's not like you change tomorrow. It literally takes months for your sleep to get better, or for you to start eating more greens or start meal planning or any of that. It takes a long time. So you just have to be really patient and kind to yourself, which I'm not good at. I want to change tomorrow and just move on, but that's not how it works. So Atomic Habits is one of my favorite books because it like reminds you how slow you need to go.
Yes. It's one of my favorite books too. You and I are on the same wavelength.
I know, we're on the same channel.
Well, that was one of the things I was going to ask you specifically is what is within our control, and you hit a lot of it, right? With the sleep, watching our alcohol intake. Truly, I mean, it is a lot of the quote basic things that most of us know to do. And when for example, when I meet with patients, right, it's, oh, well, I know I should be doing, but I'm not, right? And so, and that's where the relationship comes in, right? The accountability, like, let's start small. You can do it. So, a lot of it is within our power to control. Like, yes, we are born with certain genetics, a family history and whatnot. That does not mean we give up. That means let's pay closer attention to how we're nourishing our body and that sort of thing.
Well, and I just want to kind of parrot what you're saying, because a lot of this journey of mine that took 6 years could have been a lot quicker if I had asked for help earlier. So like the resources that you offer, where you talk to someone about their food, their sleep, all of that. Like, I wish I talked to someone sooner. That would have saved me so much time. So like, I tell my patients now, like, find a nutritionist, find a personal trainer, find a sleep expert, go, or not find, but I'll give you the people, but have a coach, because that will fast track your progress so much versus just trying to like, oh, I listened to this Huberman podcast. I listened to this you're trying to like put it together yourself. And I think of like trying to put medical school together myself. I could have never. So like, why not listen or learn from somebody who's done this and been successful and help yourself go so much faster, and that's what I'm personally like putting my money into now are these coaches. So I want somebody that's teaching me nutrition. I want someone that's, looking at my muscle index and helping me build muscle, because that's hard. That is hard as a woman.
Yes.
And we have not been taught that like men have. We haven't been in the weight room the same way. We haven't been told to be big and have protein and be strong. We've been told to be small.
Yes.
So I really applaud you for doing this. And I love the name of the podcast, right? Because it's about nourishing ourselves. Great. And it's so great.
And you're saying all the things that I'm like, this is great. We're going to have a 4-hour episode. I love that you're like, women. I mean, we were not taught to take up space, right? Mm-hmm. We also weren't taught how to eat for our bodies, especially with like hormonal transitions, for example. Yeah. I mean, keeping muscle on is a challenge that is just built in us. So it's like, girl, start now. Like everybody listening, if you're 30, start now. If you're 50, now.
No, I'm 30. I'm proudly 38 years old, and I'm starting this version for the first time, or this journey for the first time. I finally got a trainer that is also like counting my macros, and we're doing all that. And I have been under eating, and I've been under eating all the wrong stuff. Like I'm not eating, I was not hitting protein at all. I was like hitting half of my protein, and I could not figure out why I wasn't building muscle. I was not, gaining weight necessarily, but I was not building muscle. And this, like, I think it's after 30, we start losing muscle. So it's like, oh my God, this is so different. And it's honestly so much better, like eating more and just working out in a different way and seeing your body change versus like what we all were taught was do cardio, don't eat too much, like be thin, like restrict and do all the cardio. And that's miserable. And I did like intermittent fasting for a while too. I was so hungry.
Yeah, I know. And that's the thing is that, it's like we do want to fast overnight, right? We don't want to eat time, but for sure there are people that will push that number of hours of fasting so high. And I'm like, no, first and foremost, if you are hungry, let's keep you a happy person, to nourish your body and make sure you are eating like enough of the right foods, right? So, I mean, you're bringing up such great points, and I'm so happy people are hearing this coming from a doctor specifically too.
Yeah.
So, thank you for all of that.
Of course.
I do want to touch on hormone therapy.
Yes.
I'm sure you get asked that a lot, and especially like if someone does have breast cancer, there is. Hey, how do you manage, the hormone therapy? Or it's a new term. I had to write this down.
I know.
Hormone therapy. I'm still HRT.
No, I say it wrong every time. But yes, there's a new, better term for it that you mentioned. But no, I mean, hormone therapy is a really tough situation for a lot of breast cancer patients, and it's a real gap actually because most women, minus the people who have breast cancer, hormone therapy is a great thing because, and all those original studies have been completely debunked, like back from the 90s, that Women's Health Initiative, I think is what it was called. And really, like, the results were misinterpreted. They had the estrogens that they were studying aren't even the estrogens that are used in practice. They were also studied on older women. So it wasn't like the right group to look at. And that all has been really debunked. And there have been studies after studies after studies all over the world that have really shown an overall benefit of hormone therapy. There's nothing else that helps our bone density, our brain health, our heart health in the same way that replacing those hormones does.
Right.
But unfortunately, there's a big group of breast cancer patients that have hormone-driven breast cancer. So that doesn't mean that the hormones cause the cancer, but let's go back to food. We love food analogies. It's their favorite food. It's that cancer's favorite food. So it's not that let's say it likes pizza. It's not that pizza like grows the person, but if that's what it likes to eat, it's going to help it get bigger and bigger.
Right.
So a lot of those patients who have the hormone positive breast cancer, which that's like 80% of our breast cancer patients have this hormone driven breast cancer. So the recommendation at this time is they not only have to stop their hormones, but if they're before menopause, we kind of have to click them into, we call it oncomenopause. So that means like cancer induced menopause. And they can't really be on hormones at this point. They can use vaginal estrogen, which is good, but it only works on the vagina.
Right.
So that really does help prevent things like UTIs. Like that's one of the big problems when we go through menopause is our vaginal tissues, all of that gets thin.
Yes.
And so, we all, or at least I remember my grandma would get UTIs all the time. And she ultimately died from a UTI. She had UTIs, she got confused, she had sepsis, she went to the hospital. That was it. And that story is so common. So anything we can do to like keep those vaginal tissues robust and strong so that they can, and also like sexually, that's besides the point. Like in a 35-year-old that you're forcing into menopause, are you going to take away her sex life too? Like that is what a lot of women have had to do. Yeah. And, the vaginal estrogen is really a bridge to that. It doesn't take care of the hot flashes or the night sweats. There are other medications that have recently been released that do help with that. But it's this other stuff that we're talking about, the exercise, the muscle building, the diet that actually helps people recover from those menopausal symptoms. And so that's kind of our bridge that we're really seeing and emphasizing and trying to help these patients with. They can do pelvic floor physical therapy, but also these other, softer aspects, the nutrition, the muscle building, the sleep, all of that is so important in these patients. And so we really have to kind of amp up all of that to support them since we can't use the HRT in the same way.
Yeah, absolutely. Wow. Yeah, I have a few friends who have, they don't have a breast cancer diagnosis, but they are in that menopausal transition stage right now. And I hear about hot flashes all the time. And I will say specifically, track your alcohol intake. Just pay attention to that one factor. And sure enough, like 4 out of the 5 I'm thinking of, they're like, Meg, if I don't drink alcohol, I don't get the hot flashes. And I'm like, well, there you go.
Oh, really?
Try your best. Yeah.
Huh.
I mean, it's wild. So the alcohol part really is a big deal. And then also
Okay.
blood sugar balance. Like when you have consistent meal timing and then your meal composition is, what it should be. That generally decrease frequency of like your symptoms, which is great.
I love that. I mean, I'm so glad to hear that because that's what I'm like telling people, and I always like verify.
Yeah.
Yeah.
Good. Okay. Conversation. My other question, and then
because I don't know if we addressed this yet, but about screening. When should women, should we be like going back to that statistic? Should we be concerned? Like, how early do you start screening for breast cancer? And what are the
because this is confusing actually, and there's a couple like it's interesting if you go to certain like big hospital systems that really their goal is to kind of get as many people through as possible. A lot of them won't start screening until you're 50. What the American Society of Breast Surgeons recommends, what I follow, is you start at 40 and you get it every year, not every other year, every year. 40 is what's recommended for the general population getting mammograms. And if you have dense breasts, you need to get an ultrasound as well. And really what I tell everybody to do is like, don't try and figure this out on your own. Go to your OBGYN. They will help you. They will kind of guide you in what you need to be doing, and be sure that you have an OBGYN who's up to date on things, and has gone to a meeting or two and is aware of what's going on. But and also if you've had a mom with breast cancer, if you've had a sister with breast cancer, we generally recommend starting screening like 10 years before their diagnosis. Obviously, if you've had a mother who maybe passed away in her 30s of breast cancer, you need to talk to your doctor as soon as possible about, because you're definitely going to start earlier than 40. Usually 25 is the earliest that we start screening people, but the guidelines are a little, and those are people who have like a BRCA1 or BRCA2 mutation. Those are the ones who start at 25. Or they've had a mom who had breast cancer at 35. So those are the situations. But always start with your OB. At Hoag, it's really nice when you go into your mammogram, they'll have you fill out a little questionnaire that gives you your cancer score and risk, and they tell you exactly what to do. So they say, hey, you need an ultrasound. Hey, you need an MRI. Hey, you need an increased screening. And they kind of take the guesswork out of it. So you just need to go to somewhere that has a good breast cancer program, because then they can kind of reach you in that way.
Okay, great. That's really helpful information, because I know we have a wide variety of ages of females specifically who listen to this. So I think that is first and foremost is knowing your history, of course, and then going to the right doctors. So going to your gynecologist, having the conversation. And so, I mean, and even if people are listening and they don't, talk with your PCP, talk with your physician and say, hey, I'm concerned about this. I want to stay on top of it. Even if you don't have a family history, great. Stay on top of it.
I mean, and again, I want to give the statistic that 95% of my diagnosis of breast cancer don't have a family history and don't have a gene.
Yeah, that's
so like, and so the whole game in breast cancer is catching it as early as possible. So that's why it's important to get it every year, because stuff usually pops up within a year. And when you catch it in that small of time frame, you usually have like the least treatment, like you don't need all the aggressive stuff the earlier you catch it.
Right.
So I really can't say enough how important. That's why, mammograms are so life-changing, because they allow us to catch it early. And even if you have dense breasts, you still need that mammogram. You still need it with the ultrasound, because it looks at things in a different way than ultrasound does. So it's still really important.
Okay. So mammogram is gold standard for identifying. Okay. Because I know there are other avenues out there.
And let's just touch on that, because I get this question all the time. Can I do thermography? Can I do, there's some new, I forget what it's called, but there's some new like water-based thing being offered in Irvine that does not work.
Perfect.
It is not scientifically proven. Like this, you need mammogram and ultrasound. Sadly, if you have dense breasts for the ultrasound, sadly, there is no replacement at this time for those that are tested, clinically proven, clinically recommended, that catch breast cancer at a high enough rate that we use them. There's a lot of tests that are not, and also what's called Prenuvo scan. You cannot get a full body scan and call that testing your breast. We have Prenuvo scans that have missed breast cancer all the time. It's just not sensitive enough. It doesn't look close enough.
Okay.
So full body scans are not good either.
Okay. Yeah. So get your mammogram, talk with your doctor, and start that journey if you need to. I will put a little plug in there for you, Dr. Kraft. So if anyone needs a breast lesion removed, if you have breast cancer, if you know anyone, if I'm talking to listeners, if you know of anyone who does have breast cancer, I mean, Dr. Kraft is the person to go to. So please keep her in mind. And you also have a podcast. I just want to throw that out there called the Next Breast Thing, which I think is so creative, by the way. Is that another creative outlet that you have? Or is it?
It is. And I can't take full credit for it. So it is, what's the word? Like the baby of the American Society of Breast Surgeons. So basically all the different medical specialties, they all have societies, and those societies put on meetings every year and they tell everybody the latest studies. They basically keep us all up to date on everything. And that's how doctors kind of keep their education up, because science is changing all the time.
Right.
And so, once we leave residency and fellowship, our learning stops unless we go to those things like meetings. And anyways, this society, they wanted to create a more, available way of getting information out other than the meeting. Because a lot of people can't take time off to go to a meeting across the country, and stuff changes so much. We should be talking about it all the time. So it's me and 5 other leading breast surgeons around the country. And, there's one in New York, there's one in Colorado, there's one in Memphis, Tennessee, there's one in Pennsylvania, and then I'm representing the West Coast. And, it's great because a lot of places do things differently. And it's just really a cool avenue for all of us to talk about kind of the recent studies and what we're seeing in practice and how things are changing and how we're kind of evolving. So it's called The Next Best Thing. It's on all the major platforms, and we have an episode about every week. So it's really good if you are just starting on your cancer journey, breast cancer journey, you just want to know some stuff. That's a good place to kind of hear from the experts what should be happening. And if you're like, oh my gosh, am I getting the right care? It's a good place to go too, because you'll see kind of what the consensus is on treatments of things.
Oh, yeah. That's great. I mean, like you said earlier, having the knowledge is what starts everything. That's how you become more aware, right? So when we have the knowledge of what do we need to do next? How old do we need to be? What, who do I go talk to? That's what you need to know. And then you got to act on it. Right. So I think that's great that you have that out there. And then,
well, and that's honestly and I use kind of my social media channel for that too, because I know that this stuff isn't readily available. I know that it's confusing when to start imaging. I know that it's confusing, what you should be eating and all that. So that's kind of where I try and fill the gap with my social media, is to really kind of answer those little questions in just bite-sized pieces. So you don't have to listen to a 30-minute podcast.
Yes.
You can just kind of get your education for the day and move on with your life. But I think, education and valid education and cited and sourced and supported education. That's the challenge of the Wild West that is the social media and the internet. We have so much information, but who knows if it's true or not.
Right.
So that's why podcasts like this, all that stuff really matters, to get your information from somebody who's actually doing this every day.
Absolutely.
And seeing it, and not like getting paid by a company to sell you their purse or something, like you just have to think of who's talking to you.
Yeah, absolutely. And it seems like, I mean, especially on social media, everyone has an opinion, whether it's, your mailman or your pilot or your neighbor or whomever. And it's like, well, my question is always what's their background? What is their experience? What is their knowledge? Right. So, I mean, with nutrition or like the latest health trends, I mean, I always encourage people, you go listen to whoever you want, just question it. Question me, question you, question the authorities, get a second opinion if you want. Right. But like,
totally
have the wherewithal to ask the questions you need to, and don't just listen to any old person on social media, because that is easy to do. That is very
it's so easy and it's so attractive, and like I get it, and there are good things you can learn from social media, but it's just there's no like you can buy a verified check mark, like there's no way to know what's real and what's not. So I think it's good to like figure out if they exist in real life and what they're doing and how their reputation is and all that too, because that means a lot. Sometimes people are on social media because they can't exist anywhere else. So you have to just think about that.
Yeah, absolutely. Well, Dr. Kraft, I mean, this has been so enjoyable, and you're just full of great information. Everything you have said. I mean, I know we need to wrap up. Is there any like words of wisdom you want to give to our listeners? I mean, I know you're all about empowering women, which I absolutely respect. So anything you would like to leave us with?
Yeah. I mean, I guess a message to the listeners and women, men, anybody who's listening, I do think I have a unique job where, a lot of people think it's too long, it's too much work, the hours are too hard. I've heard my niece the other day, my 16-year-old niece was saying this. Someone was like, oh, I'm going to go into anesthesia because they have a lot of vacation or something. And I was like, what are you talking about? Like, who thinks about jobs based on vacation? I have as much vacation as I want. I have a life that I can completely create. And I just want to say, like, at the end of the day, if you're trying to figure out what to do something where you lose track of time, where you are just so curious. You can't stop looking it up at night. You are obsessed with it. And that is gonna beat like anything else any day, and then you're able to get through the hard times and you come out on the other side and you can build a life that you love. I did not see a lot of examples of young women doing surgery, living a great life. I saw a lot of examples of surgeons who worked all the time. Their families hated them. Their children were frankly like screwed up from their parents not being around. I had a lot of bad examples of doctors, and, it's very hard to say, I don't care. I'm going to do something differently and still follow your dreams. But I just want to kind of like New York City was for me, just be an example of what's possible. And really, like, if you love something, don't let anybody tell you can't do it. It's very hard in our young lives to question authority figures and say like, nope, I'm going to do it anyways. But I had, one of the people in my medical school be like, are you sure you want to be a surgeon? Like, you should just do anesthesia. Cause it's such a hard life. Like, and I honestly listened to them for a little bit before I actually went for it and decided to do surgery. I luckily had like a come to Jesus moment where I was sewing someone's hand up on a mountain in a wilderness retreat. And I was like, I love this. I can't not do this ever again. Like, I don't care what that guy said. I'm doing surgery. And I did it and it worked out. And again, it's just another example of like, when things click in, when things align, like I truly believe like the universe then like pushed me on my path, and I went where I was supposed to go. And, I learned about oncoplastic surgery and the rest is history. But yeah, just remember, like, if you have a dream or want to do something, do it. and don't listen to anybody else. Like, cause if you love it, like that's what matters. Cause you're going to spend so much time doing your job.
Yes.
So,
yes. Oh my gosh.
I love it.
Like, I mean, at the very beginning, when we had our little intro, I'm like, I already feel empowered. And now I feel empowered. You're just so inspiring to listen to. And thank you for sharing your wealth of knowledge, but also sharing like your journey and your background and what you believe, especially for empowering women. So Dr. Kraft, thank you for being on here today.
No, Meg, thank you for having me. This stuff like absolutely lights me up. I love doing it. So I'm so honored to be here and to talk to your listeners. So thank you so much.
I feel like we're probably going to have you back again because this was really enjoyable. So
absolutely.
Thank you for your time. And everyone, thank you for tuning in to Nourish MD podcast. And we'll see you next time. Take care.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.